Hey, Dr. Tyler Williams at Better Sleep SLC. Thanks for checking out today's video. You're here because you're looking for some answers or questions about a home sleep study, or maybe one for your spouse or someone you care about. And the first thing to remember is there are two types of studies. There is an in-lab study, which is overnight at the hospital, and then there's the home sleep study. The home sleep studies are nice because they're easy to do, they're in the comfort of your own home, and they're about a tenth the cost of the overnight sleep study at the lab. Now, that being said, there are cases where an overnight sleep study is a better option. However, ongoing, the home sleep studies are nice because they're relatively inexpensive and easy to do, and most people are just more comfortable with them. So we order a lot of sleep studies, one, to see what kind of sleep breathing disorder someone may have, but the other reason we order them is for ongoing maintenance and to ensure that they're still sleeping better, that the improvements last. Because as medications change, as your weight changes, as medical conditions change, so can your sleep breathing, and that can be one of the biggest impacting things in your whole life and in all of your medical health, because that's hopefully how you're spending about a third of your life is asleep. And with a home sleep study, you wear something similar to a wristwatch. Sometimes there's a finger reader or a chest strap that goes with it. Some of them will have two nasal cones that go in here. It's not a CPAP. A lot of people ask us about them because they think that a home sleep study means they have to wear a CPAP. That is not the case. We're simply screening to see what may be going on, and then we have a physician that's board certified in sleep medicine who interprets the study and tells you what it means. So we look at a lot of these throughout the day, and it's really fun to help people manage their sleep disorders, including snoring or obstructive sleep apnea, and start feeling better. One thing to be mindful of, and questions we get, is, okay, well, if I have sleep apnea, now what? And it's important that you have some options reviewed. If you've ever had orthodontic treatment or your teeth straightened, a lot of people have retainers, and a lot of people who have sleep studies find out they have some type of sleep breathing issue, ask about continuing to wear their retainers, or maybe they've worn through them. And usually you'll want to have some type of mouth appliance, whether it's something for clenching or grinding and you're wearing a CPAP, or something like an oral sleep appliance that actually replaces both. It acts as your retainer to keep your teeth straight, and it helps you receive continuous open airway therapy so you can get air in and be able to breathe. There's no one size fits all. Sometimes we often will get 2 nights of the home sleep studies just to make sure in case something was a little off one night, and then plan on probably once a year, once every couple of years, getting an updated one. I've done them multiple times. We've owned some different equipment and different kits, and so I like to test them out and try them out. Some of the newer ones are even just a ring. It's a big ring that you wear for a couple nights, and that's pretty cool because that allows you to be able to get a home sleep study easier than ever. A lot of people also ask about smart devices like Apple Watches or Samsung watches. There's a lot of Fitbits. That's another one. And those are really great for monitoring. They're not great at diagnosing. They don't have as many numbers that they read. And compared to an in-lab sleep study, those offer the most amount of things they read. But they're really good for looking at some patterns. There's even some that are just rings that you wear now, almost like a wedding ring, that we've tried out. They're pretty cool. So if you have some questions on these, please reach out. If you have some things that have worked well or have not, leave your comments below so we can check those out. You can also call or text us. Our information is below this video. So thanks for checking this out today. Look forward to hearing from you, and have a great day.